I'm Sanaz Kehan. I'm a reproductive endocrinologist and infertility specialist at RMA Northern California. I grew up in Marin County. I do feel like the Bay Area is home for me. Outside of clinic, I enjoy staying active, spending time with my family, and I love traveling. What led me to fertility care, I would say, was actually a very personal decision. I found out that I was actually a carrier of an X-linked genetic disorder. It was a condition that I sadly lost my brother to. And so I decided to pursue IVF with PGTM. Today, I'm the mother of 2 healthy children, and I feel incredibly grateful to have had this technology. I'd say what inspires me the most about reproductive medicine is that we are constantly having new innovation, new technology, and this all just helps to improve the success rates for our patients. Beyond the science, I would say what excites me the most is seeing how resilient and how brave our patients are. It's truly quite remarkable. And the best reward of all of this is that positive pregnancy test. That is by far what excites me the most. I chose RMA because RMA is very much committed to the patient experience. RMA Northern California set up a system where patients can contact their doctors really very easily and without any barriers. This gives me a sense of peace knowing that I know exactly what's going on with my patients. I'm always in the loop. And then, of course, it puts the patients at ease knowing that they have access to me and are able to communicate with me easily. And then, of course, RMA has wonderful success rates. So I knew that by coming here, I was going to be able to provide the absolute best care for my patients. The most common misperception about visiting a fertility clinic is that when you get here, you immediately go to IVF or have to do the most aggressive advanced treatment. And in reality, our focus is really to figure out the diagnosis, the underlying cause of the infertility. And sometimes much more simple intervention, less aggressive treatment may be the way to go and not immediately going to IVF. I understand that the fertility journey is a very emotional one. There are moments of highs and there are moments of lows in this process. I always will validate the feelings of my patients, try to stay open with them and honest with them. And ultimately, we will celebrate the wins, we'll work through the challenges together. And what I really try to do is keep a forward-looking mindset. This journey can feel incredibly isolating and can feel very lonely, but I want our patients to know that they are absolutely not alone in this process. All of us here at RMA are here to support our patients, be advocates for them. And having gone through this journey with IVF myself, I know how lonely it can feel, but I also know that holding on to the hope is the most important thing you can do. Without a doubt, the best part of my job is helping people start their families, whether it's getting that first positive pregnancy test, getting the photos of the babies when they're born. It is by far the best reward I could ask for. And it truly is a privilege to be able to be a part of people's lives in this really challenging time in their lives. So tomorrow I actually have a couple coming to introduce their 3-month-old to me, and I am beyond ecstatic to meet their little girl. And really just the thought of seeing them holding their baby brings tears to my eyes. And the fact that this is my job and that RMA allows me to do this for a living is absolutely incredible.